In response to a soft tissue injury, rest, ice, compression, and elevation, otherwise known as RICE, can be an effective tool to control and decrease local swelling. As well as swelling to the site of injury, pain can be controlled and minimized by RICE methods, drug therapies, or therapeutic modalities. These methods include the use of NSAIDs, ultrasound, and IFC, all of which act to decrease pain at the site of injury. In response to an ACL injury, knee extension is hindered and must be restored to regain the limb's full range of motion. Starting with the patient laying horizontal with the knee in 90-degree flexion, the therapist passively manipulates the limb into knee extension. Right before the patient feels pain, the therapist will stop passive movement and hold the current position for 10 to 15 seconds. This activity should occur 3 times per day. A recommended 5 reps and 2 sets with 1 to 2 minutes rest between sets will aid in regaining the limb's range of motion. In the completion of passive extension performed on the knee, more progressive steps must be taken to further increase range of motion. With the patient laying horizontal on their stomach and the knee in 90-degree flexion, the therapist first places a 2-pound weight to the ankle. The therapist passively moves through extension up until the pain threshold, at which point the limb is held there for 10 to 15 seconds. A recommended 5 reps and 2 sets with 1 to 2 minutes of rest between each set will aid in regaining the limb's range of motion. When the patient feels comfortable with the passive extension motions, active extension will incorporate muscle groups needed to sustain the knee. With the patient laying horizontal on their stomach and the knee in 90-degree flexion, the patient actively moves through extension up until the pain threshold, at which point the limb is held there for 15 seconds. This activity should be done 3 times per day. A recommended 5 reps and 2 sets with 1 to 2 minutes of rest between each set will aid in regaining the limb's range of motion. In restoring and improving the knee's flexibility, the patient lies horizontal on their stomach, with the knees over the edge of the table. The patient actively moves through extension to its maximal range, at which point the opposite foot is placed over the injured limb to more forcefully extend the knee, holding for 5 to 10 seconds. This activity should be done 3 times per day with a recommended 5 reps and 2 sets. In further increasing flexibility, a method called autogenic inhibition can be used. With the patient lying on the ground, uninjured leg is positioned at 90-degree flexion towards the ceiling. The patient extends the injured leg and actively brings the knee as close to the face as possible, while maintaining full extension and hips remaining on the ground. The therapist holds the current position for 30 seconds, at which point both the patient and therapist attempt to pull the limb towards each other. After 5 seconds, the patient then attempts to once more actively bring the limb closer to the face while maintaining full extension. This method can be repeated several times to achieve maximal flexibility. Occurring 3 times per day, a recommended 5 reps and 2 sets with 2 to 3 minutes of rest between each set will aid in regaining full flexibility of the limb. To increase flexibility of the quadricep muscles, the patient lies in fetal position with the injured limb facing the ceiling. With the leg already in extension, the patient holds the injured limb at the base of the ankle and actively extends the hip. At full flexion, the position is held for 5 to 10 seconds. This exercise should occur 3 times per day. A recommended 5 reps and 2 sets with 1 minute of rest between each set will aid in regaining flexibility of the quadriceps. To strengthen the quadricep muscles, the patient will perform isometric contractions. Lying supine with the hip flexed at 90 degrees and knee flexed, the patient attempts to extend at the knee while the therapist pushes down on the lower limb, preventing any movement. Each repetition should be held for 5 to 10 seconds. This should be done 3 times at 40, 60, and 90 degrees of flexion at the knee, with 1-minute rest periods between repetitions, and done 4 to 5 times per week. To further strengthen the quadricep muscles, the patient sits on a chair and performs full-range concentric contraction of the quadriceps using a thermoband. The patient should complete 3 sets of 8 reps with 1-minute rest between sets. This should be done 4 to 5 times per week. To prepare the lower limb and quadricep muscles to return to activity, full-range concentric contraction of the quadriceps using a leg lift machine and additional weights are completed. Perform the same rest period and frequency as concentric contraction of only limb weight, while increasing the rep scheme each week by 1 set. In order to retrain the patient's proprioception in the lower limb, the patient performs a single leg squat. While standing next to a support on the injured limb, the patient breaks at the hip and flexes at the knee, lowering the body towards the ground until the knee reaches 90 degrees. The patient performs 3 sets of 8 reps, with 1-minute rest periods between sets, and should be done 4 to 5 times per week. Further challenging the patient's proprioceptive abilities, the single leg squat next to a support is performed on a foam pad to create an imbalanced surface. The same rep scheme, rest period, and frequency should be followed as a single leg squat. To increase the difficulty of this exercise, eliminate the support in the single leg squat on the foam pad. In maintaining joint characteristics above and below the knee, step-ups incorporate the hip and ankle to achieve the movement. Initially standing, the patient steps onto the elevated surface with the injured leg, then bringing the body up to the surface. The patient then steps down from the elevated surface, injured leg first. A recommended 8 reps and 3 sets 4 to 5 times a week, with 1-minute rest between each set, will aid in maintaining the joint above and below the knee. In further incorporating the hip and ankle, step-ups are performed with a 5-pound dumbbell in each hand throughout the activity. A recommended 8 reps and 3 sets 4 to 5 times a week with 1-minute rest between each set will aid in achieving greater stability at these joints. Increasing the intensity of a step-up transforms the activity into a jumping motion. Initially standing on the injured limb, the patient jumps up onto the elevated surface. After holding the landing for approximately 2 seconds, the patient then jumps back down to the original surface, holding the landing once more. A recommended 8 reps and 3 sets 4 to 5 times a week, with 2 minutes rest between each set, will aid in achieving maximal stability at these joints. In aiming at returning to sport, functional activities such as a burpee can be implemented into the rehab program. Initially standing, the subject places both hands on the ground and steps each foot posteriorly until push-up position is reached. The subject then steps feet back to their original position and stands up. Completion of this motion 5 times constitutes 1 set. A recommended 2 sets 3 times per day will aid in the functional capacity of the knee towards returning to sport. In intensifying the steps of a burpee, the patient performs the same motions, but instead of stepping each foot back individually, the feet move together in a quick, swift horizontal jump. Upon reaching push-up position, the patient jumps both feet back to original position and stands up. A recommended 5 reps and 2 sets each 3 times per day will aid in the functional capacity of the knee. In further intensifying the motions of a burpee, the patient performs the same progression, but instead of simply returning to original standing position, the feet are brought back to original position followed by an upward jump. A recommended 10 reps and 3 sets 4 to 5 times per week will aid in the functional capacity of the knee. In maintaining cardiovascular fitness, the patient performs aerobic exercise on a stationary bike. At approximately 50% VO2 max, the patient should cycle 20 minutes per session 3 to 5 times per week. After 2 weeks of cycling, the patient increases cycling intensity to 60% VO2 max and lengthens duration to 30 minutes per session. In aiming to improve cardiovascular fitness, cycling intensity increases to 70% VO2 max for 30 minutes per session. This activity should occur 3 to 5 times per week.